Are there emerging neuroprotection therapies for stroke patients? Imagine a future where we can better protect the brain during a stroke and improve recovery outcomes. That future is becoming more real as scientists develop new therapies aimed at safeguarding brain tissue and enhancing healing. While traditional treatments like clot removal and clot-busting drugs are vital, researchers are exploring additional ways to prevent secondary brain damage and promote repair. Neuroprotection has long been a challenging area because the brain's response to stroke involves complex processes like inflammation and cell death. Many promising compounds have shown success in labs but struggled to prove their worth in human trials. Recently, however, new strategies and delivery methods are giving hope that effective neuroprotective treatments are on the horizon. One exciting area involves drugs that can be given alongside existing treatments. For example, a medication combining edaravone and dexborniol has shown promising results in clinical trials, helping more stroke patients recover better. Another candidate, called Sarara, has demonstrated strong potential, especially when used with procedures that remove blood clots. These drugs work by protecting brain cells from damage during the critical hours after a stroke. Researchers are also investigating innovative molecular approaches. For instance, a scientist at the University of Connecticut is testing a receptor inhibitor that reduces inflammation and improves recovery in animal studies. If successful, this could lead to new medications that protect the brain in ways we haven't seen before. There are also developments in using microRNA inhibitors, which could extend the window for treatment up to 15 days after a stroke. This means patients might receive help even after the initial hours, giving more time to prevent long-term disability. Beyond drugs, non-invasive techniques like remote ischemic conditioning are being studied. This method involves briefly restricting blood flow to a limb, which triggers protective responses throughout the body. It activates pathways that reduce inflammation, improve blood flow to the brain, and support brain repair. Multiple clinical trials have shown that this simple approach can improve neurological outcomes after stroke. Regenerative medicine is another promising field. Scientists are exploring the use of stem cells, especially mesenchymal stem cells, which can turn into nerve-like cells and help repair damaged tissue. These cells also reduce inflammation and promote new blood vessel growth. While early studies are encouraging, large-scale human trials are still needed to confirm their safety and effectiveness. Emerging technologies like artificial intelligence and brain-device interfaces are also making strides. These systems help patients who have lost movement or speech to regain some control by training their brains to communicate directly with external devices. Though still in early stages, these innovations could dramatically improve quality of life for stroke survivors. Another important development is the expanded window for performing mechanical clot removal. Previously limited to within 6 hours, this procedure can now be done more than 6 hours after symptoms start, giving more patients a chance at better recovery. While these advances are promising, it's important to remember that most are still in research phases. The best way to protect against stroke remains managing risk factors like high blood pressure, diabetes, and lifestyle choices. If a stroke occurs, current proven treatments like clot removal and clot-busting drugs are essential and should be administered promptly. In summary, many emerging neuroprotection therapies are being tested and refined. They aim to protect the brain during a stroke and improve long-term recovery. As research continues, these options could become part of standard care, offering hope for better outcomes. Always consult healthcare professionals for personalized advice and remember that ongoing clinical trials are the pathway to new, safe, and effective treatments.